Welcome to Hope in the Face of Cancer, where we share real stories of courageous people in their cancer journey. Today, we are honored to welcome Dr. Lorraine Frazier, Dean of the Columbia University School of Nursing. Since 2018, she has led one of the nation's premier nursing programs with a vision rooted in equity and compassion. In 2022, Dean Frazier's professional mission became deeply personal when she was diagnosed with breast cancer. What followed was a season of resilience that tested her in new ways. Her cancer journey not only reshaped her life, but also deepened her commitment to ensuring that patients are truly seen and heard. Under her leadership, Columbia has expanded its global focus and is preparing the next generation of nurses. Today, Dr. Frazier brings her experiences as a leader and survivor into her work, reminding us that the most powerful kind of healthcare combines science and humanity. Dean Frazier, we are so fortunate to have you on the show today. Thank you so much for joining us.
Oh, it's wonderful to be here, Darcie. Thank you for having me.
Well, I just applaud our nurses. I mean, it's such a labor of love and a calling that, you really have to be compassionate and just have a heart for service. So tell us what first ignited your passion for nursing.
Well, I remember that very, very well. My father was diagnosed with a chronic disease when I was 11, kidney disease. And we spent a lot of time in hospitals, and I watched people coming in and going out of the room. And I knew what our family needed to know. And I knew how they needed to know that, how we should be told. And I knew.
Even at that young age, that's amazing.
Yes. Oh, absolutely. I knew the pain. It was a family. Sometimes we think that a patient is diagnosed, the family is diagnosed. Definitely.
So true.
Yeah, we all held that. And I knew if I were behind those doors, I would know exactly what to say to my family. And I wanted to do that. I wanted to do that for other people. I did. Yeah. So I went into nursing, and it just seemed like the perfect fit.
Oh, that's incredible. We're so grateful that you have, because you've had such an impact on so many lives, not just, directly in your nursing experience, but now really lifting up that next generation of nursing leaders. So how did your nursing path, take you into academic leadership where you are today?
Well, I always loved school, always. And nursing is such a wonderful career. There's so many things that you can do. So I became interested in research. I remember I was supervising in the hospital. I picked up one of the journals, and I read how we could do a procedure that we were doing better, suctioning. And I brought that into the other nurses, and I said, we should be doing it this way. And they looked at me like, this is the way we've always done it.
Right.
I thought, who makes these journals? How do they find out how you do what you're supposed to do? And I was introduced to nursing science. So I knew that I wanted to go back to school, and it took me a long journey. I ended up doing a master's as a nurse practitioner, then a PhD, and a postdoc in genetics to understand really how our stress impacts our physical body. That's what I was looking for. So it was just, I was always one to ask questions, and I wanted to answer some of the questions. And then I wanted to get that information out to educate nurses in the newest ways to do things, and really to ensure that the care that we were giving our patients was up to date and was science and evidence-based. That was important to me.
Oh, that's incredible. You're certainly a lifetime learner, and so many have benefited from that passion that you have of digging deeper and finding out how to do things better. And I think having at the heart of everything that experience that you had as a child, it shaped you, I would imagine.
It did. Yeah, there's no doubt about that. And a lot of people come into nursing with the heart to serve. And those are the people we love to get, because we know that when times are tough and things are stressful, that they're in it for their own reason. They have meaning. They make meaning in those patients interactions and whatever they're doing, we like it to be something that they're, we used to say call to, but really, I would say call to
Yeah.
do.
It's your why. Having a why
Yes,
is so
absolutely.
important. Yeah,
Yes,
absolutely. Grounds you.
it does. It does.
So tell us about how you are shaping this next generation of nurses. I mean, what is your vision? I mean, if you could kind of shoot forward in time and look back, what do you most want to accomplish in this role that you are of leading this next generation of nurses?
I want them to have that heart for service, and I want them to have the newest knowledge, how to get that knowledge, how to use it, have it, that technology at their fingerprints, at their fingertips, and how to, whenever they're giving information, it is the latest information. For example, if I see a nurse practitioner in the clinic and I have experienced this and I need something for, I don't know, a symptom that I'm having. And they'll say, you know what? Let me check the evidence. That means let me check the evidence for someone your age with your diagnosis, whatever, and let me get you the latest. I really have chills when I think about that. That's what I want for our nurses to feel that empowered that the clinicians at the bedside are using the information from all the latest evidence that they have so that those families can do the best they can. That's what's important to me. And so when I stop a student in the hallway, tell me how you make a decision. So and I want to hear them tell me what technology they're using. How do they base their information on using that technology? What gives them that strength? So we have clinicians, our faculty all teach, but they all have a clinical practice. So they're all out there practicing. So they see how that is used in the clinics and the hospitals. So it's really important to me that we give the best graduates out there.
Oh, I love that. And in this information age, I love how you are really training them to be kind of in that moment, looking for the best information, the latest and greatest, because there's so much new information and research coming out every day.
There is.
And you're cultivating this kind of spirit of being in that moment and utilizing the best information in the moment. And that will prevent but this is the way that we've always done it, right?
Exactly. And, it also gives the patient power and knowledge to be their own partner in this journey. And that's what you need. You need that information. So, what we do is incredibly important to really, and I can't emphasize this enough, not just take the information, but apply it to that individual person.
Right.
Whatever parameters must be applied, because you can't use just any information, right? You have to really be selective and really teach the patient how to do that.
Yeah, very person-centered care.
Yes, absolutely.
I love that. So in May 2022, your life took a turn. You were diagnosed with breast cancer. And I understand that, many people kind of reassured you, everything's going to be fine. But take us back to that moment of your diagnosis. I mean, you've been on the other side of healthcare for so long. What was that like to hear those words?
Yeah, you're taking me back. Well, I had just lost my daughter 4 months prior. So I was pretty numb.
Yeah.
And I remember not really being surprised, just thinking, okay, all right. And so now what? That was the initial reaction. And of course, then it's trying to understand that. You feel like, okay, what does that mean? In cancer, to so many people that I've talked to, the first thing you think is, will I be here?
Yeah.
How long do I have? And I remember thinking this, is it a year? Is it 6 months? Just tell me what to expect. And that was where I sat. My husband was with me. And And I was reassured, but still, it's like I equate it to going through the looking glass, like Alice. Only you don't voluntarily step into it.
Right.
All of a sudden, you find yourself in a looking glass because everything that's important to everybody else is no longer important to you. It's like your world is the exact opposite of everybody that's standing around you, right?
Yeah.
And that's very different. It's very, very different. So, and trying to have a conversation with someone who doesn't understand that, and yet they're supposed to be directing your care is difficult. I remember I had to go to get a bra with inserts in it. After I would have a mastectomy, I would have to wear this. And I went, of course, we're in New York in this building, and it was an office building, and we opened up, and here's this little private store. And it was one at a time, only, people that were waited on and by the shopkeeper. And she was older, and she was standing over me, and I was sitting at this in the chair, and she was talking all about these bras. And I was like, who is she? And she's talking, but I really couldn't hear her. And she got down in my face and she said, I had a double mastectomy. And all of a sudden, she appeared to me. It's like I saw her for the first time. I said, you did? Oh. And she sat with me, and she was an entirely different person to me. Wow. She was able to talk to me.
Yeah.
And that taught me a lot. It taught me the importance of having someone that can relate to you, work with you. Yeah. And then she was able to share. And I left that store feeling like I can do this. So pretty amazing how you're able to connect to people in a different way.
Yeah.
And before that, no connection, none. And she saw that. She was just looking at me, probably thinking, I'm trying to talk to her, and she's just in another world. Oh, yeah.
Oh, it's so powerful to be able to connect with someone who understands what you're going through, and there's just no replacement for that. I mean, you can have the best, most caring medical team, but having that person who has walked that path is so critical. It's why we focus on our mission as a survivor by your side. It's huge.
Indescribable, the difference that you all of a sudden just connect. It's like a light bulb goes on. It's like then you speak the same language. Before, she's just talking in the background, and you're watching her and thinking, what is this all about? And then she starts to speak to you in a language that you understand. Yeah. And it's amazing. Really.
Like a sigh of relief.
Never.
Yeah. Was there anything in that time as the patient that shaped your moving forward, what you're teaching, just your perspective on being a leader in healthcare from going through that personal experience? Now, once as a caregiver to a parent, but then as the patient yourself.
Yes. It was an experience, and it was just a typical day on a nursing unit, right? But for me, it wasn't a typical day. For the patient, it's never a typical day.
That's right.
So it was my first infusion, and I had watched a film the day before about a young woman who had her infusion. She talked about going, and this was later because she had her hair, right?
Mm-hmm.
I parked my car. This is the sidewalk where I walked. This is the room. This is the chair I sat in. And I thought, okay, I can do this. So I woke up ready to go. Sat in the chair, and the first thing I heard was, where's your port? I said, I don't have a port. You don't have a port? They said I didn't need one. Oh, I usually don't work on this unit, but, let me see and it was that. And what I tell my students would have been so good. Now, I had my husband with me, and I had a lot of information, but still, if she had held my hand, just touched me and said, this is your first infusion, but we're ready for this, and you're going to do fine, and it's not going to hurt.
Yeah.
And this is oh my gosh. But she
A
didn't know it
world
was
of difference.
She didn't know it was my first. She was probably capable in every way, and she was. I had a good experience. But I was reminded how important it was to always understand the patient.
Yeah,
It wasn't a typical day for me.
that's right. Yeah.
Yeah.
And who
Yeah,
knows
I never thought I'd
what
be.
was going, yeah, who knows what was going on, for that nurse. But when you have that first interaction with that patient you're seeing for that first time, I mean, the
Yes.
role that you play in what they're feeling in that moment is so powerful.
Yes, and present. You must be present. It's not about information. I was just reading a little bit ago about AI. They'll replace workers who are knowledge workers, but never workers who are hands-on.
Yeah.
But why they don't is because it's that touch, that personal connection is so valuable that can't be replaced. But how important it is that we understand that as healthcare providers. Now, I've had many, many good healthcare providers, and I'd like to use that just as an example, not of nursing. I guess I had many good nurses since then, but as an example of how important it is to all of us to be reminded that, just be aware.
Yeah. That's a person,
Yes,
with a
absolutely.
lot of emotions running through them in that moment.
Absolutely. And what if I had been a single parent, an older individual without a husband there, scared to death? I had a hard time parking. I got in, I went and I was sitting there and I had no idea. What if I had been that person, right?
Right. Yeah. So you get to share those stories now.
Yes.
From a unique perspective with your students. And
Yes.
I think that's hugely powerful for them to get to feel what it's like, to be in the patient's shoes for a moment.
Yes. Yeah.
So today you say that you feel healthier than you've ever been. So
Absolutely.
what helped you get there? What has changed?
For one thing, I knew that health was going to be a big part of this journey.
Yeah.
I knew I had to partner with my body,
Yeah.
my healthcare team. And the one thing that someone told me, it was one of my physicians said, weight is not your friend. Okay. All right. So I went home and we changed everything that we ate. My husband cooked and we had just a healthy Mediterranean diet. We both lost 30 pounds.
Wow.
In fact, he was my proof that it wasn't because I wasn't eating. Yes, I'm eating.
Yeah.
And we walked 5 miles every day.
Wow.
When I first got back from the hospital, I had my drains in. We walked across to the park and we walked around the park, not quite as far as we had gotten to when I was doing my infusions every day, 5 miles. And ate good food, drank a lot of water, and I did fairly well. I worked throughout the whole time. And yeah, I did. And I learned a lot about the importance of your environment. Put your body in the environment that it needs to thrive. And so today, when I get up, I stretch. I have a really good breakfast of fruit and yogurt and have some coffee. Then I get up and I walk 50 blocks in New York to work every day. And then when I get home at night, do some more stretching every other day. I work out on weights and I feel better than I have ever felt. And, my physician reminded me, and it's true, the number one thing killer of women is heart disease. I am more likely to die of heart disease now than breast cancer. But the same things that you do for heart disease are important for breast cancer, are important for heart disease. And that's what I studied. And so the diet, the eating well, exercise, taking care of your stress. I did meditation this morning, which I usually do. And then I don't let things worry me. And that's saying a lot with academics and everything that we've been this year. If something happens, I always think, okay, this is not life threatening. We're going to get through this. And so I deal with stress a lot in a lot different way. And for someone who's new, I think there's a book that I read, The Cured, and the author, I have to get the author for you, but read that book, Jeffrey Ridiger, Ridiger. He talks a lot about, the path toward health. And I think I gave myself permission not only to do that, but to enjoy it.
Yeah.
And I have never felt better. I really haven't. I do everything I want. Yeah, it's been a good journey. And my husband, his cholesterol dropped 50 points.
Wow, that's incredible.
What are you doing?
Yeah, so great that y'all could do that together and be on that journey together.
It is. And I think the one thing you can do is be a role model.
Yeah.
Because we can all do that in some little ways. It doesn't have to be 100%. You get up and you start walking, but just walk a block and walk home. And then maybe in a couple of 3 weeks, walk 2 blocks. And sometimes it's just, can I get out of bed? Can I get out of bed and brush my teeth? Maybe that's where you are. But yes, just little bits and little bits. Just keep thinking ahead. I remember I had a chart on my refrigerator with gold stars. When I would accomplish things throughout the week, like I had radiation and every time I would complete it, I would put a gold star. And I think, I'm getting there. I'm almost through. It's just a way of looking at things that you get there. And the people that supported me who had been in this position, who were now doing well, would say to me, Lorraine, you will get there. And I look at them and I think, okay, I will. It gave me hope seeing that they're doing well. So another reason to show up for someone, they need to see you. When I first was diagnosed, because of my physician said, you have to decide whether you're going to tell people or not, right?
Yeah.
Well, because I needed to find somebody when I was first diagnosed, I wanted to be the person other people could find. I thought, if I tell and if I share, and it has happened, colleagues come to me who are first diagnosed, and we've gone through it together. So it's just giving back what I've been given. And I think, we're all just walking together.
Yeah.
Helping each other.
I think there's healing in sharing your story as well, especially when you can share it with someone who's been there and understands. I think that's all part of the healing process. I think sometimes we do ourselves a disservice in our own healing by keeping things in and not wanting to burden other people with them.
No, it's not a burden to people. It may be to some people because they don't understand how to first approach you, right?
Yeah.
It's the first meeting, but it'll happen. You may be a little uncomfortable, so may they. It's just part of life. But yes, it does feel healing to share and to be shared with, definitely.
So we often ask people, go ahead.
And we know that. The other thing that helped me, my daughter was disabled.
Mm-hmm.
And I remember when she was little and we're trying to figure out what was wrong. I would stop on their mothers and I'd say, how was your baby? And if I'd see somebody or heard somebody that had a child with developmental disabilities, I'd want to talk to them. And I remember that yearning to talk to somebody so badly. And I knew that I could help in this situation. And the person that helped me, she'd just text me every once in a while. It just seemed like a text from heaven. Doing okay today? That's all. She would just say something every once in a while. And when she did, it was just when I needed to hear it.
Isn't that amazing? Yeah.
Yes. So don't hold back. Don't think, should I bother them? They're ready to hear from you if you're supporting someone with cancer. There is never a bad time to connect, ever.
That's right. I love that. I think our volunteers would love to hear that too.
Yes.
So we often ask our volunteers when they go through training to become a CanCare volunteer, what gift of cancer they've received. And at first they're kind of look at us like we're crazy. But then as they process that, I've not had one yet who hasn't come up with a gift. What gift did cancer give you?
Well, I have a cup and saucer that I drink from sometimes, and it's an Alice in Wonderland quote. And she says, "Don't ask me who I was yesterday. I was a different person then."
That's good.
So I would have to tell you, I was a completely different person. To go back to that, I never could. I think differently. I appreciate things differently. I express my feelings more. I'm less stressed. I'm a different person, a completely different person. So I could never put my hand on just one thing. Really, I mean, yes, completely
It changed you
It
in
did,
so many
in a good
positive
way.
ways.
Absolutely, absolutely. And now I think, I enjoy each day. I know it's about the journey. I realize it's not about getting anywhere. At the end of when I was sitting there one day at my couch and I had, been pretty accomplished and had things just the way I thought that I wanted them, I thought, so this is it? Like, is this it? Is this why people live? And I realized it isn't. It isn't for the future. It's for each moment and each day. It's sharing a smile with someone that you don't know. It's being kind. It's being the human being that we were meant to be every day. That's what life is about. And so how much more I enjoy each day, right? I do. The sunsets, the coffee. In fact, my friend said to me, well, that will leave in 2 years. And it's been 3 and it's still here. I'm so glad because I don't ever want it to leave. I really don't. In fact, I had a birthday not too long ago, and now my birthday is to celebrate. Before I used to say, I'm too busy.
Right.
It doesn't. Well, it does matter. It does matter. You matter, and the people around you matter. But for cancer survivors, they matter. Look in the mirror and just tell yourself, you matter. Taking time for you is really putting money in an account for you that will take you further and healthier. Every time you exercise, it's banking for you. So you do matter. How you live matters. How you eat matters. How you take care of your body matters. So that has totally changed. Totally changed. It's great.
That's amazing. That's amazing. So I've got some quick fire questions for you to give our listeners a little glimpse of you personally. A song that carried you through treatment or that brings you strength.
Love to Me is Like a Summer's Day by Louis Armstrong. And I know that's kind of strange, but I love that song because he talks about, and I had to look at the words, about being still and warm and peaceful.
Oh, I love that.
And I love that, and it talks about winter shadows seem to disappear. And I love that because that's where you can be when you choose to. You get to choose your reality, right? You get to choose how you wake up. And so I chose sunshine, and peace, and try to do that every day in my life. So that song, every time it comes on, my husband goes, "There's your song.
There's your song." Oh, I'll have to add that to. We have a playlist for anyone facing cancer, and I will have to add that to our playlist. So we'll do that. What food or drink helped you most during treatment?
All night. ate all these bowls, like they'd be avocados and colorful salads and chicken and fish and salmon. That bowl, it was actually a bowl. And so we still use those bowls. And it was just brought the food together in a way that you could see it all. And it was wonderful to eat. So drink.
Probably beautiful too.
Yes, yes. I used to take pictures of them, and I still do. Drink is tea. You know, I'm from Ireland. I grew up drinking tea. I drank tea from my mother told me from mine was about 1.5 with cream and sugar because it was warm, right? And I constantly, I have a cup of tea right now.
It's your comfort. It's an instant comfort, right?
Yes. Oh, yes, yes, yes.
How about the most meaningful piece of advice you received from another survivor?
Oh gosh. Well, you know, from the clinician was weight is not your friend. Don't underestimate that. If you have breast cancer, don't forget that. From a friend, and I could just hear her tell me, it'll get better. You get on the other side. And because I was so focused on getting through each day, that each day, you know, it's enough to get through, right? You're thinking but there is another side, and I'm on it now. Yeah. And that's something you should always remember. You know, breast cancer, just for breast cancer is one cancer where people are surviving more, not just to early detection, but also to treatment.
That's right.
We have treatments that are amazing today, and I think that's important for survivors to know.
Yes, that's great. How about what book or quote inspired you most during your journey?
The book Cured. Read that. And what book or what did you say? Saying?
Yeah, what book or a quote?
You know, I have very deep faith. So every day I would, and I still do, have my with my daily Bible readings. So they're all together. But, you know, it made me really understand that things happen for a reason. And I never would have ever believed how important it was to my life to have this journey. And it has been personally, it has been for my enjoying my life, for meaning in my life. So many ways. It just is, I was always supported. I always felt that whatever I needed would be there when I needed it. And that's exactly the way it happened. It would just unfold when I needed it. So I never felt not loved by God. And that was really important to me. It was just incredible, really. Yeah. So my faith was very important to me. So I'm glad you asked that question because, and I share that with other people, because knowing that you are not the center of your world, that there's something else that's you're a part of is really important to health.
Absolutely. So if you were sitting with someone today who just heard those words, you have cancer, what would you want to share with them?
Well, I would just sit with them.
Be present.
And I would just say, I'm still here. I'm here. I'm here. Because being there is 100% of what you can do for someone. You know, it's just being there with them. I think that's all they need initially, you know. And if you're a survivor, as your team is, that's what they want to see.
Yeah.
They want to see, oh, you know, she looks okay. She seems to have a life. She went through this. And many times people say, well, did you get treatment? Yes, I did. Like, okay, well, maybe I'll do all right. And that's reassurance to them.
Yeah.
And reassurance to them that life still goes on. I mean, we have made so much progress in cancer treatment today. And I always tell young people, look, even if you look back at studies, they haven't been treated the way we treated people in the last 5 years because they haven't been alive enough to be treated. So the studies are getting better. The interventions we know are improving. So I know it's bad when you're young, but it's good when you're young because you have a lot of new treatments that we don't have today that will be available to you. So I know it's never a good time, but there's never been a better time to have to need treatment for cancer.
Yeah.
So tell people, absolutely, it's true. And that's what they need to know. The other thing they need to know when they're talking to individuals, it's not so much, today we learn the biologics suffer cancer. And so we have very different information. So you don't compare yourself to other people because there will be people who don't have exactly what you have. And so all cancers are different. They're different diseases.
Yes.
It used to be, we used to think heart disease was heart disease. But there are many paths to heart disease. It just has the same clinical symptoms. Right. And so the same with cancer. So, stay in your lane. When you want to get information, get it from your oncologist. Accept that information and go with it because everybody else who gives you other information doesn't know your story and your disease process. Everybody else can give you information on health and give their story of what helped them. But it's always important when it comes to actually treatment that you talk to your team. I think that's really important for patients to know.
So true. Thank you so much, Lorraine, for sharing your story and
you're welcome.
Sharing your message of hope with our audience today. And thank you all for joining us for this episode of Hope in the Face of Cancer. If you or someone you love is facing cancer, CanCare is here to support you. Visit us at cancare.org to learn more. Until next time, remember, there is always hope in the face of cancer. Thank you for joining us on this episode of Hope in the Face of Cancer, a survivor by your side. If you or someone you know is facing cancer or is supporting a loved one through their journey, we invite you to share this podcast. Thank you for your support in our efforts in the cancer community. No one should face cancer alone.